What I'm about to show you is going to change the way you look at the two little products sitting in your bathroom right now. Or taking Finasteride for your hair. There is a very real chance that one thing you have been dismissing, a change you chalked up to age, or stress, or a bad week, is actually your body responding to the medication in a way nobody fully explained to you. And that is the part that concerns me. People do not usually run into trouble with these two because the medicine is bad. They run into trouble because they were handed a bottle and half an explanation, and they miss the signals that would have told them how to use it correctly, or when to adjust. Stay with me, because the single most important point on this list is the 11th one, and it has nothing to do with side effects and everything to do with why most people quit, right before it finally starts working. I'm Dr. Alan Brooks, and if you have been told to use Minoxidil or Finasteride, there are 11 things you genuinely need to understand. Not because your doctor is keeping them from you. Because appointments are too short to cover any of this properly. I have been a board-certified dermatologist for 35 years, focused on hair and scalp, and more than 10,000 patients have sat across my desk. And a huge number of them arrived either afraid of these two medications because of something they read online, or already using them completely wrong, and wondering why nothing was happening. Both problems come from the same place. Nobody sat them down and explained what these things actually do inside the body. What to expect, and what is normal versus what is not. So that is exactly what we are going to do today, calmly and clearly. By the end, you will understand how each one works, which effects are common and harmless, which ones are worth a phone call, and the one truth about timing that decides whether you keep the hair you are trying to save. This channel is where I say what I never have time to say in a 15-minute visit. Before we start, let me be very clear about something, because it matters. Nothing in this video is a reason to stop a medication your doctor prescribed. If anything here raises a question for you, the answer is to talk to the doctor who prescribed it, not to quit on your own. Stopping suddenly, especially with hair treatments, can undo months of progress overnight, and I will explain exactly why later. This is about understanding, so you can use these tools well and have a smarter conversation with your own physician. So let me start with what these two things even are, because most people lump them together, and they could not be more different. Minoxidil is the foam or liquid you put on your scalp, and now sometimes a low-dose pill. Finasteride is a tablet you swallow. They attack hair loss from two completely different angles, and understanding that difference is the foundation for everything else. So here is point number one. Minoxidil does not touch the hormone driving your hair loss. Not at all. What it does is widen the small blood vessels in your scalp and push more follicles into their active growth phase. Remember, most hair loss is driven by a hormone called DHT, slowly shrinking the follicle. Minoxidil ignores that hormone completely. It simply improves the blood supply and wakes resting follicles up. Think of it as turning the water back on for a garden that was drying out. It does not fix why the soil went bad. It just gives the plants more water so more of them grow. That is why it helps so many people, and also why, for some, the results plateau. It is treating the water, not the soil. Point number two, and this one catches almost everyone off guard. When you first start Minoxidil, your hair may fall out faster for a few weeks. This is real, it is documented, and it terrifies people into quitting on day 10. It is called a shed. Here is why it happens, and why it is actually a good sign. Minoxidil pushes your resting follicles to hurry up and begin a new growth cycle. To start that new hair, the old resting hair has to be pushed out first. So you see a wave of shedding, but that shedding is the sound of the machine starting up. It usually begins around week 2 to 4 and settles by week 6 to 8, replaced by finer new growth. The mistake is panicking and stopping right at the moment it is working. If you quit during the shed, you get the worst of both worlds, the loss without the regrowth. Ride it out. That wave is the treatment doing exactly what it is supposed to do. Point number 3. Minoxidil only works for as long as you use it. This is the deal nobody spells out at the pharmacy. The new hair minoxidil grows is dependent on the minoxidil. Stop using it, and within a few months those gains shed away, and you return to where you would have been. This is not the medication failing. It is simply how it works, and you deserve to know it before you start, because it is a long-term commitment, not a short course. Antibiotic, a bottle you finish, like watering a plant. The day you stop watering, the plant responds. So before you begin, decide honestly whether this is a routine you are willing to keep. That single decision saves people a lot of heartbreak. Now, before we get into the second medication, do something for me. Type in the comments which one you are using: Minoxidil, Finasteride, both, or you're just researching before you start, and tell me your age. You will be surprised how many people are right there in the same boat as you, scrolling this very video. Point number 4 takes us to Finasteride, and this is where we finally deal with the root cause. But first, let me make sure you actually understand the enemy. Both of these are fighting, because it makes everything click. Your body naturally produces testosterone. An enzyme called 5-alpha reductase converts a small portion of that testosterone into a far more powerful hormone, dihydrotestosterone, or DHT. In most of your body, DHT is useful. But in people with genetically sensitive follicles, DHT locks onto receptors at the base of the hair follicle and issues a slow shrinking order. Each time that follicle completes a growth cycle and rebuilds, it rebuilds a little smaller. The hair comes back finer, shorter, and lighter, until eventually it barely surfaces at all. Doctors call that miniaturization. It is not that your hair falls out all at once. It is that it quietly downgrades, generation after generation, until the strand is too wispy to matter. That single process, DHT shrinking sensitive follicles, is behind the vast majority of the hair loss these two medications are designed to fight. Now, with that in your head, here is what Finasteride actually does. Finasteride is a pill that blocks that very enzyme, 5-alpha reductase, so less testosterone gets converted into DHT in the first place. By lowering the amount of DHT reaching your scalp, it slows the shrinking at its source. If minoxidil is about the water, Finasteride is about the soil. It is the reason many doctors use them together, one improving the growing environment, the other stopping the underlying damage. Understanding this is what lets you see why the two are partners, not competitors. Point number 5. Finasteride is primarily studied and prescribed for men, and there are important reasons it is handled very differently or avoided for women, especially women who could become pregnant because of risks to a developing baby. If you are a woman dealing with thinning, this is not the automatic answer, and there are other approaches your doctor may consider first. The mistake I see is people, of either sex, borrowing a partner's pills or ordering from questionable sources online without a proper evaluation. This is a hormonal medication. It belongs in a real conversation with a real physician who knows your full picture. Please do not freelance with it. Point number 6. Yes, Finasteride has possible sexual side effects, and I am not going to pretend otherwise because you have read about them and you deserve honesty. In the clinical trials, a small percentage of men reported changes in desire or function. Here is the balanced truth, though. For the large majority of men, this does not happen, and for many of those who do notice something, it resolves. The reason I want you calm about this is that fear itself is powerful. Anxiety alone can cause the very symptoms people are afraid of. So the sensible path is simple. Know that it is possible but uncommon. Pay honest attention to your own body. And if something changes and persists, do not quietly panic and do not silently quit. Call your doctor and talk it through. There are options, including dose adjustments. This is a conversation, not a trap. Point number 7 is one almost nobody mentions, and it can matter for years down the road. If you are a man over a certain age, Finasteride can lower the reading on a common prostate blood test called PSA. It does not harm your prostate. In fact, it is used at higher doses for prostate reasons. But it can roughly have that PSA number, and if your doctor does not know you are taking it, they might read a normal-looking result and miss something they should have caught. The fix is effortless and important. Make sure every doctor you see, especially anyone ordering that blood test, knows you take Finasteride. That one sentence lets them interpret your results correctly. This is exactly the kind of thing that gets lost when care is split across rushed appointments. 2 more effects to understand, and then the most important point of all. Point number 8. Both of these can occasionally cause scalp or skin reactions, but for different reasons, and telling them apart saves you a lot of confusion. With Minoxidil, the liquid version in particular contains an ingredient called propylene glycol that many people are sensitive to. It causes an itchy, flaky, irritated scalp, and people wrongly blame the medication itself and give up. Very often, the answer is simply switching from the liquid to the foam, which usually leaves that ingredient out. The mistake is abandoning Minoxidil entirely, when the real culprit is one inactive ingredient in one particular formulation. If your scalp reacts, do not assume the drug is wrong for you. Try the foam first. Point number 9. Minoxidil applied to the scalp can, in some people, cause unwanted hair growth in places you did not intend, most often on the face, especially in women or anyone using more than directed. Here is why. If the product runs down with sweat or transfers from your hands or your pillow, it can stimulate follicles wherever it lands. It is almost always a technique problem, not a reason to stop. The fix is straightforward. Use the exact amount directed, no more, because doubling the dose does not double regrowth, it just increases side effects. Apply it, then wash your hands thoroughly. Let it dry fully before bed, and consider using an old pillowcase. Precision solves this one completely. And now, point number 10, the mistake I watch sink more people than any side effect on this list. Using too little of one, or expecting the wrong thing from each. Some people dab a tiny bit of Minoxidil only where they see the most scalp, missing the wider thinning area, and then decide it does not work. Others expect Finasteride to regrow a full head of hair, when its main job is to hold the line and stop further loss. With regrowth as a bonus. Matching your expectation to what each medication actually does is half the battle. Minoxidil is your best shot at regrowth. Finasteride is your best shot at keeping what you have. Judge each by its own job, applied correctly, over the full recommended area and dose. Which brings me to point number 11, the single most important thing in this entire video, and the one I promised you at the start. Timing. These medications work on the schedule of your hair's biology, not on your patient's, and that mismatch is why most people quit right before the payoff. Here is the honest timeline. For the first few weeks, you may see that shed we talked about, which feels like failure, and is actually the opposite. For the first 2 to 3 months, often nothing visible happens at all on the surface, while everything important is happening underneath. The first real signs, usually less shedding and some fine new growth, tend to show up around month 3 to 4. And the honest verdict, the point where you can look in the mirror and truly judge, is at month 6 to 12. Let me tell you about James, 58, a patient of mine, who came in discouraged, ready to give up on Minoxidil after 10 weeks because, in his words, it made things worse and then did nothing. He was in the flat, silent middle, right after the shed and right before the growth. We did not change his treatment at all. We just changed his expectation and asked him to give it to month 6. At that follow-up, he brought photos. Real regrowth across the front. Nothing had been wrong with the medicine. He had simply been about to quit 2 months before it paid off. The mistake with these treatments is never the chemistry. It is the calendar. Mark 6 months on your own calendar today. Take a photo of your scalp now under good light, and do not render a verdict until you get there. So here's exactly how to use all of this. If you are on Minoxidil, apply the exact directed dose to the entire thinning area, not just the worst spot, once or twice daily as prescribed. Wash your hands after, and let it dry fully before bed. If the liquid irritates your scalp, ask about the foam. If you are on Finasteride, take it consistently at the same time each day. Tell every doctor you see that you take it, and pay calm, honest attention to your body without living in fear of the rare. If you are on both, understand that they are doing 2 different jobs, one growing, one protecting, and that together they are more effective than either alone. And whichever you are on, take a dated photo every month, same light, same angle, and hold your final judgment until month 6. Your memory will tell you it is not working long before the truth is in. One thing, doctor to viewer, and I mean this as strongly as I can say it, everything in this video is for understanding, not for making changes on your own. Do not start, stop, or adjust either of these medications based on a YouTube video, including mine. If something here raised a concern, that is a conversation to have with the doctor who prescribed it, who knows your history, your other medications, and your full health picture. And if your hair is falling out suddenly, in patches, or with any other symptoms, see a dermatologist in person, because that can point to something entirely different. I am a doctor, but I am not your doctor. Now, people lose the game before they have really played it. These 2 medications are among the most studied hair loss treatments we have, and they genuinely help a great many people. But they patience through a shed and a silent middle that feel like failure. And consistency, day after day, long after the novelty wears off. Meet those 2 demands and give it a full 6 months before you judge, and you give yourself a real, honest chance. And let me leave you with the mindset that separates the people who keep their hair from the people who lose it. The ones who succeed are almost never the ones with the best genetics or the most expensive routine. They are the ones who understood what they were doing, set their expectations correctly, and refuse to quit in the quiet middle. Knowledge is what carries you through the months when the mirror has not caught up yet. That is the entire reason I made this video. Because this was never only about hair. It is about walking into a decision with your eyes open, understanding exactly what you are putting on your scalp or into your body, and being able to sit across from your own doctor as an informed partner instead of a confused patient. That is control. And now you have it. So mark that 6-month date, take your photo tonight, and come back and tell me in the comments which one you are using and how far along you are. Type your age too. I read every one. Take care of yourself. I will see you in the next one.